The March 20th meeting of the Human Services Committee will now come to order. Actually, the March 29th meeting, I'm sorry, will come to order. Will the clerk please call the roll?
Ms. Andrews, Mr. Daniele, Ms. Cayley, Mr. Lightfoot, Dr. Quattro, Mr. Rocco, Chairwoman Draw.
Here. Is there anyone signed up to speak for public forum?
There are 2 public forum speakers this evening. Would Raji Root please come forward? You will have 2 minutes to address the committee, and please conclude when the timer sounds.
Just read. Okay. Hello? Okay. Good evening. My name is Raji Root. I've been part of CDPAP for 4 years. I started with Center for Disability Rights, and I had to switch to Maxim in November 2010. Throughout the transitions, I had some good and bad experiences. I want to talk about a couple of issues I faced with Monroe County's nurses. Then I want to propose an idea that will improve accessibility with Monroe County and the CDPAP. First, I face communication barriers all the time. Look at me, I cannot communicate with my hands, but I can speak. However, most people cannot understand my speech, so I typed up everything with my big toe. It is exhausting trying to communicate my needs with the nurses. I am often misunderstood. Last month, Monroe County's nurse interpreted my miscommunication with them as immaturity. I lost CDPAP because they felt I could not handle it well. Second, aside from communication barriers, I have faced attitude barriers. Monroe County nurses talk to my SDO over me all the time. It makes me feel small and invisible. I want to be acknowledged as a person and be respected too. Talk to me and hear me out. I propose diverse disability training for Monroe County nurses and CDPAP providers. CDR is an excellent example of a diverse community with people of all disabilities. We live in one of the largest deaf populations in the nation, and it makes sense to offer more training that will help break down these barriers, not just for me, but for everyone with disabilities. I am willing to sit down with any of the legislators to help Monroe County and CDPAP improve their accessibility to the deaf and hard of hearing community, as well as all people with disability. I hope you will be willing to sit down with me about these needs. Thank you. Raji Root.
Thank you.
You're welcome.
Our next speaker is Dean DeRusso.
Hello. Maybe you already know me from the Deaf System Service Advocacy and Independent Living Center here. And my job is to provide services for clients such as Rajiv. I have brought a handout that you can read for yourselves later, but I want to just simplify what I've written here. The CLS program has stopped, and now people like Raji are losing services. Services are being dropped, and it's really sad. He's sent to an agency that doesn't understand his communication needs. We really need some training, some sensitivity training regarding communication, and miscommunications and communication breakdowns that happen without people even really knowing. And that's not been approved for the CPDAS. And it's very expensive. I know that budgets and funding are very tight right now. And those people that provide service are being paid, and that's just costing more money. I would like for you all to think about the budget and the expenses that are going to these agencies that are providing services, and they're not using that money to provide communication services for clients such as Raji. I have 2 suggestions for you, and these are on the last page. One is for change CDR back to what we had before, which is we had deaf staff available for services. And that helped communication with clients and the agencies and how to improve services. Really, his voice has been lost. His voice is from his toe at this point. He's having to communicate through his toe or lip reading. He's not able to speak. It would be a big advantage to have 2 interpreters available, a deaf interpreter and also a hearing interpreter. The 2 work together as a team, and that's very expensive. That's the type of service that's needed. Thank you very much.
Thank you.
This concludes the public forum.
The next item on the agenda is the approval of minutes. You have before you the February 15th minutes before you. They stand approved unless the clerk is notified of any changes by the end of the day. Next item of business is new business, Madam Clerk.
Referral 11-57, amend
Moved by
resolution.
Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-58, acceptance of a
Moved
grant.
by Legislator Quattro, second by Legislator Daniele. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-59, acceptance of a grant.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-60.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Legislator Andrews.
Thank you, Madam Chair. And through you to the administration, this referral is dealing with the HIV Emerging Communities Program. And at the end of last year, Dr. Doniger spoke to this body about the increase in HIV infection rate among young people in our community. And my question at this point in time is if he would be kind enough to give us an update on those statistics and what we've seen since the beginning of 2011 to the current time. How those numbers look at this point in time, and if we are still seeing an increased number of young people diagnosed with HIV. Thank you.
Through you, Madam Chair, just to clarify, are we on 0059 or 0060?
0060.
Oh, okay. I'm sorry. We sped up through a couple more than I missed one.
That's fine.
Well, thank you. I did speak about the change in the rates of new cases of HIV infection in young people in our community previously. Before 2010, we had primarily been seeing new cases of HIV infection in an older population. And then in 2010, things seemed to change. We alerted the community. We did a press conference and have been communicating with our partners in the community about HIV infection and sort of the changing epidemiology and the differing needs of the new cases. We have not updated the data at this point, and so I don't really have final statistics for 2010 yet. But we're hoping that at the end of March, we'll pull all the data together for the year 2010, and hopefully we can provide a little bit of an update, but I don't have that tonight. There has been a lot of work going on in the community, particularly in the Rochester City Schools, and through a new coalition that has been formed and pulled together by the Monroe Council on Teen Potential to try to really alert young people to the new hazards related to HIV in our community. And I'm hopeful that we can make a difference and alert them, and that we won't see a continuing pattern here of even more cases of HIV infection in youth.
Thank you. Through the chair, would you be willing at the conclusion then of March for our next meeting to come back and discuss with us the data that you have compiled at that point in time?
Through you, Madam Chair, yes, I'd be happy to do that.
Thank you.
Thank you. And I just also do want to state how pleased I am to hear of the coalition's work with the city school district, and I hope that is fruitful, and I hope that does help certainly combat this alarming trend that we are seeing at this point in time. Thank you.
Thank you. So any other discussion on that? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-61,
Moved by
amend.
Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Andrews.
Thank you, Madam Chair, and through you to the administration. I kind of lose track of HEAP over the years, how it's been administered. My recollection is a few years ago, New York State kind of took this over, and they're the one who actually issue the HEAP funding or HEAP grants at this point in time, and yet the county administers the program. And the rates or the funding that we have received seems to vacillate over the years. Could someone just give me kind of an explanation at this point in time why the funding that the county would receive would have increased to a little bit over $2.3 million for administering HEAP?
Through the chair, this is Nancy Forge, Director of Financial Assistance Services for the Department of Human Services. I think what you're referring to as far as the state taking over administration of the funding is what we call an auto payment for recipients of public assistance and food stamps. The HEAP benefit is automatically issued at the beginning of each heating season. And as the numbers of food stamp recipients in Monroe County has risen in the last 2 years, the number of payments automatically issued by the state has also increased.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-62,
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
referral
Moved
11-63,
by Legislator Rocco, second by Legislator Quattro. Any discussion on this? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
referral 11-64,
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion on this? Legislator Andrews.
Thank you, Madam Chair. My question through you to the administration is this appears to be a contract with ME Engineering for mechanical, electrical, and plumbing engineering term services at the hospital starting this year. Who has been providing those services up to this point in time?
Through the chair, Jason Kennedy with Environmental Services. ME Engineering held the term contract for the prior 5-year term.
Thank you. And through the chair, I'm assuming then since this proposal proposes to give them the contract again, that you've been satisfied with that work.
Through the chair, that's correct.
Wonderful. Thank you.
Legislator Cayley.
Yes, thank you, Madam Chair. Just a clarification on, through the chair, in the additional 4-year extensions with the increase, is this standard that the contract may be raised with the Consumer Price Index?
Through the chair, yes, that's a standard practice that we allow the contract to be increased year over year by the CPI.
Okay, thank you.
Any other discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. At this time, I would like to let Dr. Doniger introduce our new Deputy Director of Public Health here for the county, if you would so like to.
Thank you, Madam Chair. I'd like to introduce Dr. Byron Kennedy, who is sitting to my right. He's a medical doctor and also has a PhD in epidemiology. He recently worked for the state of California legislature as a policy analyst, and so he is very familiar with the concepts around developing legislation and is very eager to learn about how working in state government and local government are similar and also different. He'll be coming to Human Services Committee, and hopefully we'll have him in this seat in a few more cycles. So welcome, Dr. Kennedy.
Welcome, Dr. Kennedy. Thank you. Thanks for coming. Is there any other matters to come before this committee? Legislator Anders.
Thank you, Madam Chair. I do have a few questions at this point in time. And I think this is rather timely. It appears that people who receive food stamps at this point have received notice of intent to change food stamps. It appears that the standard utility allowance has changed and decreased maybe from its previous amounts, as well as it's anticipated that starting April 1st, the food stamp benefit will decrease as well. I wonder if someone could explain these changes. I don't think they were decisions made by the county, but if you could just elaborate a little bit on what's going on with how the changes in these rates will affect the people that we serve.
Absolutely. Through the chair, the state is required to at least every 2 years adjust what we call the SUA, the Supplemental Utility Allowance. It's a standard allowance for public assistance and food stamp recipients. It is a formula that the state uses based on consumer price index at a certain point in time. Historically, that has been rising, so prior years, recipients saw an increase in their food stamps. This past year, believe it or not, the heating and utility average expenses were less than they were the last time around, so it's resulted in a reduction in the SUA and therefore a reduction in the food stamp benefits.
Thank you. And has this correspondence informing recipients, has that gone out to everyone who is a beneficiary?
Yes, through the chair, it has. The state sent out automatic notices to all affected recipients.
Through the chair, do you have any idea in the county how many people this affects?
Through the chair, I do not.
Would there be any way to find out that figure, so we're aware? We're starting to get a lot of questions about this from constituents.
Through the chair, I will look into that and report back.
Thank you. I have another question. During the budget season last year in the area of human services, the budget alluded to the fact, or I think one of the department directives alluded to the fact that MCH was going to be exploring subcontracting of the food and laundry programs or services to private vendors during this year. I wondered if anyone at the table could comment on if we're proceeding down that route, and if so, where we are in that process.
Madam Chair, it's my understanding that the RFP responses were received at the end of January, and that the responses are still being evaluated by the team at MCH and others, and so that process is ongoing, so that's why no recommendations have been forthcoming.
Thank you. Could you also speak a little bit to the motivation for doing that? Is that a cost savings measure or a decision of dissatisfaction with the way the services are currently provided, or what would be that rationale?
Through the chair, Scott Adair, the Director of Finance, that was a cost savings measure.
And thank you. And how much is that anticipated to save?
Through the chair, I'm not exactly sure I remember the number. If my memory serves me correctly, it's between $300,000 and $500,000 for the 6-month period beginning July 1st was put into the 2011 county budget.
Thank you. In reviewing a little bit the category of employee that would then lose their job by this, and
Andrews, I'm not sure that this is pertinent information since the budget has not actually been passed yet.
This is regarding our budget, the county's budget.
That you direct your comments through the chair out of respect to the chair, please. Thank you.
No problem.
I thought you were inquiring about the budget for next year.
I'm sorry. Through the chair, Mr. Adair, did you say July 1st of 2011 or 2012?
Through the chair is the only budget that's been put forth in front of this body is the 2011 budget. I was referring to July 1st, 2011.
Thank you. Right, and that was my understanding. We were talking about the current year's budget that had been passed. I think in reviewing the employees here that this would affect, these folks, I believe, are usually Group 1, if that's the lowest paid employee in the county, I believe, is that the right terminology, either Group or Level 1 employee, the food and laundry workers that we have. So these are people that are making approximately $18,000 a year or less that stand to lose their jobs as a result of this new structure that the county and the hospital is pursuing. Is that accurate that those are the employees that would be affected through the chair?
Through the chair, I wouldn't be able to speak to that. I'm not that familiar with the actual grading of the employees that perform these functions for the hospital.
Okay. I mean, it is my understanding here that this, if passed by this body, would outsource work of the food and laundry service employees at the Monroe Community Hospital. I think there are almost 100 of them, and that currently they are, if not the lowest, the second or third to lowest paid employees of this county who would stand to lose their jobs if they're not hired by the private contractor. I find that very troubling. And because
Legislator Andrews, though, I think Mr. Hefner did state that we do not have, the RFPs are just coming in for that. We do not have information on what is going to happen next year.
Madam Chair, I believe, again, this is for this year, starting in July of this year.
For this coming year, correct.
Of this current year, right, which is why this is very pertinent. And regardless of who gets this contract, if the work is no longer done by MCH, the workers will no longer need to be employed by MCH, and therefore will be laid off. So this idea contemplates laying off almost 90 of our lowest paid employees of this county. I find that very troubling, and I think that it's something that we should get ahead of and explore a little bit before the referral comes to us so that it's not reactionary. And perhaps if some of us find that we don't really want to go down this road of laying off 90 of our lowest paid employees in this county, we could work to stop that.
Maybe I could ask you, Legislator Andrews, if you would like to put that in writing and through this committee, and that we would submit that
Sure.
and get some answers.
Okay, I'd be happy to put my concerns in writing to the committee.
Yes, Legislator Daniele.
If I could speak to that for a moment, although I certainly understand where Legislator Andrews is coming from, to the administration, most likely outsourcing this type of work would remain a local activity. So although we may be losing some jobs currently employees of the county, most likely whatever operation would take over these services would most likely have to hire additional employees in order to perform the same services. Is that true?
Through the chair, not knowing who the respondents were, would not be able to confirm nor deny that. I believe that as Assistant County Executive pointed out, this RFP, the responses to the RFP are currently being reviewed to determine whether or not the practice of outsourcing these particular functions is feasible for the hospital, at which point in time there would be a recommendation put in front of this body.
Thank you.
Any other questions? Legislator Andrews.
Yes, Madam Chair, just to Legislator Daniele's point, I mean, it is possible that obviously the services will still have to be provided, but if they are outsourced and then taken up by a private, excuse me,
The comments are out of
Legislator
order.
Quattro, I'm responding.
It's all conjecture. This is all out of order. It's just immaterial to the business of this committee. There's no referral in front of us. This is all conjecture. We haven't even completed the RFP process, and we're already arguing about this. I think that the discussion's out of order, and that's my opinion, and I think it should end.
Okay. And Legislator Andrews, I think if you would like to submit your questions in writing, please. We'll put it through this committee, and then we'll have some answers in the future.
Madam Chair, I was actually responding to Legislator Daniele's point, because I think that while the work may be kept locally, the employer will change.
Okay.
Legislator Quattro, do you not think the hospital is germane to this
Legislator
committee?
Andrews,
It falls
through the
under our
committee.
responsibility.
I understand.
But again, that's, okay.
Okay. Let's just go back to this, okay? Submit your questions, please. Any questions you have regarding the RFPs and regarding through this committee, we'll go to the administration, and that's how we will handle it. Thank you. Is there any other discussion not on that topic?
Yes.
Legislator Andrews.
Thank you, Madam Chair. I do have a question. I have heard media reports regarding our concern about the state budget that appears to have been now agreed upon by the three important parties that usually negotiate the
Legislator
budget.
Andrews, I don't believe we've heard anything that a budget's been agreed upon. This committee has not heard that we've had a...
Madam Chair, I think it was reported yesterday, if not Sunday evening, that there is a very likely budget that was agreed upon between the governor, the majority leader, and the speaker. And my question goes to the fact that the county executive has made comments regarding her concern about this perhaps creating as much as I think a $20 million gap for the county. And so my question through you to the administration, because I'm imagining that a large portion of that would fall under human services, because most of their budget does fall under human services.
And at this point, the Human Services Committee has no knowledge of that budget being passed and of what the situation is going to be as far as the funding for 2012.
Well, Madam Chair, with all due respect, I mean, the committee members may not, but perhaps a member of the administration may have an understanding at this point in time, because I imagine in order to come up with a prediction of how much of a gap that's going to cause us, we have done some work on it.
Again, I think
So
that the conversation's out of order.
You know,
The county executive's comments spoke for herself in the paper. We don't have a budget that's passed, so it's all conjecture again. So the questions are out of order.
Does nobody here want to do anything ahead of time? I mean, I'm sorry, I don't understand the
that, but we don't
blocking of these
Legislator
points.
Andrews, there was no budget passed as right.
And no, there's no budget passed. I'm asking through you to the administration for some information.
So, I think we're done. Legislator Lightfoot.
I want to agree with my colleague, Legislator Andrews. I believe that these questions are germane to this particular portion under our business. We have the responsibility as legislatures, as we're going into extreme fiscal times, to be kind of proactive in our way we leading, especially financially. There are many projections brought through us through the administration, and I think simply she's just asking, what are the projections through you, Madam Chairman, to the administration? Just simple, and if it's something that could be done via her writing them out again, I think that's appropriate as well, but I don't think her questions are out of order to this body. I just think that a simple question that we as legislators moving forward, looking financially over the responsibility of the human service and the people constituents that we represent, to have a projection from our administration. We know that you got to be looking at this thing long term. You just can't be waiting for a budget to be reactive to the budget. That's ridiculous. And if we're saying that tonight, then we really need to just pack up our bags and go home, because literally we're never going to get our budget problem solved if we're just waiting for someone else to do something. So I think, to you, Madam Chairman, I disagree with Mr. Quattro, and I think that these questions are germane.
You may disagree, Legislator Lightfoot,
I think
but
and I want to appeal to the chair to let my colleague continue to ask her questions and let administration answer her questions.
There's no referral before us.
We're not talking about referral. This is under other business. This is business that matters of this body under other. That's the reason why we have other business under this body, so we can discuss other business. This is other business. So you refuse to answer a simple question as what are the projections that might be affecting of the human services?
There is nothing.
So you guys have done no research as to...
budget. Legislator Lightfoot, there's a proposed budget.
You guys are crazy.
There's no budget that is passed. No.
It's unprofessional, and it's wrong to...
Legislator Quattro. At this time...
Let's just adjourn.
Legislator Cayley. As long as it is something not pertinent to...
Through the chair, thank you. It is going back to the food stamp reduction. In light of the food stamp reductions, I just would like to know if it is a matter of practice that when these notices come out, do they also go out to the food kitchens that exist within the county, or is it filtered down?
Through the chair, the county has no control over who the notices go out to. It is a state notice. They don't ask our counsel or advise us in advance of who it's being sent to.
Thank you. Is it possible that we, through the county process, actually find out if food kitchens in the surrounding area get these notices in a timely fashion or not? And if they do not, if we could just put them on a mailing list?
Through the chair, I can ask for additional clarification. I would offer that there is a grant-funded food stamp nutrition and education program coordinator that has taken the role within the county of notifying food providers when there are changes to state and federal food stamp allotments.
Thank you.
Is there any other discussion? Seeing none, that this, the March 29th meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee is scheduled for April 26th at 6 p.m. Thank you.